Hi, and welcome to this edition of Psychology for Life with me, Dr. Sandi Mann. Psychology for Life looks at how the application of psychology can help us in everyday life. So I want to talk to you today about GPs, your family doctor. I've had terrible problems, like everybody else, trying to get an appointment for my family and members of my family. What a nightmare. Now, I've been with our family GP for years and years, maybe 30 years, I can't even remember. I've always been with them. And in the last year, it's just been an absolute nightmare. They just don't have any doctors available. You get an appointment eventually for 6 weeks' time, and then what tends to happen is that they cancel it a few days before. You scramble to make another one in 6 weeks, and then they cancel that. It's just ridiculous. But I just accepted it. I said, this is the way it is. Nobody's going to be any better. It's terrible. This is the way it is. And it went on and on, really, for the best part of a year. And I was talking to somebody and I said, why are you putting up with this? Change doctor. And I'm like, change doctor? Oh, that's a bit drastic, isn't it? I've been with this doctor ages. I know them. I'm comfortable with them. And she's like, yeah, but you can't get an appointment. And I go, yeah, there is that. So, do you know what? I changed doctors. And I've gone to a new practice where they actually have doctors that work there. It's still hard to get an appointment, but they do have doctors and they don't cancel the appointments. So I thought there's a lesson here for us, a lesson for applying psychology to life, that really we too often stick to something that's really bad, something that's really uncomfortable, just because it feels familiar to us. And it's a bit like the devil, a case of the devil you know versus the devil you don't know. So we stick with something, we stick to abusive even or difficult situations, even when they're bad for us, because we're familiar with them. And I see this with clients and patients who often go from one abusive or bad relationship to another, or to a pattern of relationships that mimics a very difficult childhood. And they don't like it, but they stick with it, or they're attracted to that kind of relationship because it's familiar. We like the familiarity. It is comforting to us, even if it's unpleasant. So there we go, a lesson for us all. Don't stick with the familiar patterns if they're not helping us in life, if they're bad for us. Make those changes, break the pattern, break the habit, move on. Mind you, still not got a GP appointment.